Good morning.
Good morning.
Let's be lively. Good morning. I'm Mike Merson. I'm the director of the Institute, Duke Global Health Institute, and I want to welcome, of course, the graduates, parents, partners, families, and friends. Did I leave anyone out? It's wonderful to have you at our commencement for our Masters of Science in Global Health program. I know many of you have traveled great distances and had to navigate our campus this morning. I do know also that there are few events in one's lifetime that are as important and as memorable as a graduation ceremony, and we're delighted to have all of you with us. I want to recognize here, if the graduates will allow me to, our faculty who have joined us today. I'd like them to stand, if they would please do so. And let's have a little round of applause. Thank you. Many faculty from across Duke serve as instructors and mentors to our graduates. Without a doubt, this program would not be as successful without their leadership and willingness to serve as mentors and to work alongside our students. A university campus is a very special place. It harnesses the passion and creativity of young minds, like our graduates, and matches them with the experience, skills, and knowledge of our faculty to solve the world's health challenges. And so my thanks to our faculty for all that they do for you. Graduates, let me be the first to congratulate you today. You are an exceptional group. Many of you have been recognized for your work and for your contributions to the Duke community. I know I do not need to tell you, you are at the forefront of an amazing and exciting field of study and work, and I am confident that you have learned here enough to position you for what's next to come, whatever that may be. But remember, graduation is not an end, but a beginning. You are the next generation of leaders in global health, and while those that have come before you have made great strides, there remains much to do to make this world a healthier place. I'm proud of what you've accomplished. All the faculty here are as well. We know that the future of our planet is brighter because you studied here at Duke. I now would like to move on with our program. I would like to introduce Professor Kathy Sikkema, Director of Doctoral Studies in our Institute, who will recognize our doctoral students. As she comes to the podium, let me invite everyone here to join us for a reception just outside the back doors immediately following the ceremony. Kathy?
Hello, everyone. Thanks, Mike. Hi, everyone. Pleasure to be here today. I actually am very excited. For the first time in this ceremony, we're going to be able to acknowledge the doctoral students in the Duke Global Health Institute. We have two different programs. The first one is a doctoral certificate, which is actually formally given by the graduate school with the PhD. Our doctoral students in DGHI are actually getting their PhDs in their home department, primary discipline, and specializing in global health. So I'm just going to take one moment to acknowledge several of them who cannot be here. Since we are doing this for the first time, we have a couple of PhDs from last year, as well as the ones from this year. So the doctoral certificate, which is based on coursework and a fieldwork experience, last year was given to Jenna Mueller with the PhD in biomedical engineering, and this year to June Wang with the PhD in pharmacology and cancer biology. The reason I'd like to note the PhDs is it will be very apparent that our global health scholars of the future are very diverse and interdisciplinary. We also have doctoral scholars at the Duke Global Health Institute, which is really a fellowship where students can collaboratively work with faculty members on research and eventually do a global health dissertation. We had two students last year, Sarah Wilson with a PhD in clinical psychology and Jae-Shing Tan-Soo with a PhD in environmental economics. I will also note we have an expected September PhD, Sarah Dieringer, in civil and environmental engineering. So the 2 PhDs that will be given tomorrow to our doctoral scholars from the Global Health Institute. First is Divya Rajan with a PhD in public policy. And last, but certainly not least, and representing all of the Global Health doctoral scholars, is he will be Dr. Christopher Paul tomorrow, getting a PhD in environmental policy, studied with Randy Kramer, and his dissertation project is entitled Understanding Decision-Making in the Face of Environmental Health Threats and Climate Change in the Case of Ethiopia. So please congratulate Chris, as well as all the other Yep, that's it. I promise to be short.
So, a little bit of an unusual item on our agenda right now. The Duke Global Health Institute has had the great fortune of having Chris Woods lead our Master of Science in Global Health program since its inception. And Chris will be taking us forward in the ceremony. But I want to say a few words about Chris. He conceived and developed the exceptional program we have today, one which serves as the model for many of the programs like ours that have arisen in recent years across the country. Chris will be stepping down. You are the last class to have Chris as the director of the program. And therefore we thought with you, we would recognize him at our ceremony today for what he's accomplished and done for you and for all the students before you. His faculty colleagues have been impressed with how much he cares for students, how he works tirelessly to nurture their personal and professional growth, all while balancing a clinical practice, directing a laboratory, and conducting robust research programs in infectious diseases around the world. Chris will be assuming a leadership position in our medical center starting this summer. We are fortunate that he will continue to play a role in the Institute, both as a teacher and a researcher. I would like to invite Chris to the podium.
Oh.
I have to have you hold that.
All right, I'll hold it. Thank you.
On behalf, Chris, of the education team, the Duke Global Health Institute leadership, your fellow faculty, and all the students and graduates whose lives you have shaped, I'm delighted to present you on behalf of all of them this gift. It chronicles your history during the years of your leading the program and is signed by your colleagues. Please join me, all of you, in a round of applause to thank Chris for all he has done. I'm now turning the ceremony over to Chris. He's sufficiently embarrassed.
So I've done this 7 times, and I've always shed a tear for you guys. Now this is the first time I'm doing it for myself, which is... so thank you, Dr. Merson, and welcome family and friends of our graduates. It's been an honor and a true pleasure to work with the tremendous faculty and staff of DGHI and Duke University to build what is widely considered the premier global health training program in the country. We are celebrating 34 official graduates this year, though I believe only 28 are here today to join us for the ceremony. Apparently, the remainder have already embarked on their global health adventures and are already out saving lives. You guys will be joining them soon. Since our inception as one of the first global health graduate programs in the country to the recent selection of now our 8th cohort, which is our largest cohort, we have embarked together on an important and a fulfilling journey to reduce global health disparities around the world. Our graduates have rigorously prepared for that journey during their time at Duke under the guidance of our superb faculty. These faculty members have taught you the content and methods necessary to meaningfully engage in the important clinical, epidemiological, social behavioral, and policy-oriented research that will help guide us to a safer and healthier world. But you brought the enthusiasm and energy necessary to carry it out, and it has certainly been my privilege to see the results of that effort come to fruition over the past 2 years for each of you. To successfully navigate the Duke Graduate School and a global health research program is not a simple logistical feat. Although our students are remarkably resourceful, I did want to take a moment and say a special word of thanks to our tremendous education team. Sarah Martin, I believe, is here with her brand new son, Miller, back in the corner. And supported by Lisa McKean, who, if she's here, can stand, Laura Bay, Ryan Quarter, Elisa Halferty, and Kara Rothberg. And now we'll clap all together. So everyone stand and be recognized. They really do a tremendous job, and I'm sure each of you appreciates the complexity of that particular job. I'd also like to recognize Melissa Watt, who's been my associate program director now for several years, as well as Mary Story, our education director for the Global Health Institute. Now, as you've heard, Dr. Watt will be taking over the master's program next year, and it has been a wonderful and sometimes trying experience to build the program, but Melissa and our terrific staff are positioned to take it to new heights. The focal point of our program, as you all well know, is the research project, which is performed in collaboration with one of our Duke faculty and usually together with an overseas mentor. This year's graduates conducted their fieldwork in 20 different countries on a diverse array of topics, ranging from determining the impact of Ebola, the economic impact of Ebola in Nigeria, to addressing opioid dependence in Nepal, to defining neurosurgical needs in Uganda. And I can say with great sincerity how universally impressed I was with the projects that our graduates have presented and submitted to the graduate school. Their success emanates from the efforts of our mentors and the local collaborators and the infrastructure established by our staff, but most of all from the students' passion and commitment and willingness to ask the important questions and to pursue their answers. Now, I typically highlight a global health icon every year as a reminder of how impactful the achievements of our graduates can be. Last year, we hosted Duke graduate and Partners in Health founder Paul Farmer as our graduation speaker, and at that time, I spoke of his longstanding commitment to fighting global health disparities, and in particular, his interest in pushing forward the treatment of victims of the Ebola pandemic. Now, I have mentioned Bill Foege in a previous ceremony, but this year, Duke is recognizing Dr. Foege with an honorary degree, and I would be remiss in not acknowledging him again. Dr. Foege, well known to many of us, and I frequently highlight his work in my Global Health Challenges course each year, which I'm sure you all remember. Dr. Foege is best known for developing the strategy that led to the worldwide eradication of smallpox. His approach was based on active case surveillance and containment through vaccination in rings of close contacts. This became known as ring vaccination. Now, prior to that discovery, it was thought that we would have to vaccinate between 80 and 100% of the world's population to eradicate smallpox. Now, a fairly daunting, if not impossible task, but the targeted strategy allowed for as few as 7% of a population to be vaccinated, and it still removed the disease from populations and much more quickly than mass vaccinations. It's estimated that the eradication of smallpox has saved over 150 million lives. Pretty tremendous. So perhaps, though, even more significantly, in his role as CDC director in the late 70s, Dr. Fege appointed Dr. Mike Merson as the first CDC representative seconded to the WHO, propelling Dr. Merson on to his storied career in global public health, which has, of course, benefited all of us here. Now, working in global health is incredibly rewarding, but at times the challenges seem enormous and insurmountable. But whether Ebola or Zika or diabetes, those most vulnerable are usually disproportionately affected. We must remind ourselves that change can happen and actually is happening, and you're playing a great role in that. Now, in my role as director of the Masters of Science in Global Health here at DGHI, I've had the opportunity to meet the next generation of global health leaders, and teaching you and working with you as you channel your intelligence and energy into positive change keeps me motivated to continue this work in the future. You are now part of a large and growing family of DGHI alumni, and we look forward to watching your next steps. So go forth and be a doer. You will inspire others along the way, and you certainly will take inspiration from each other's successes. So congratulations, and I applaud your success here.